huge amounts of work, huge amounts of money trying to support the infrastructure and the people providing care. And the conflict, of course, is that when we look at the usage of our service, the people who are using it are often the younger generation. It's often people providing feedback and looking for care for their parents. One of the other things we work very hard on is in nursing and residential care. That's such an area, again, where it's hard to get clinical outcomes, if there are any. But the people who are really powering that are not the people who are receiving the care themselves, but their family and their children. And I think that will filter down even further. As you say, they always go to the web. They always use social networks. I almost think that they expect it to be there, but I don't think enough work has been done. I'm sure some has, but I think there probably can't be enough done in this respect. The other thing that's interesting when you think more about providing services for users and consumers is the cost is a fraction of the money that we invest and continue to spend on supporting the providers. The cost of these sort of services, it doesn't even get, it doesn't even feature on the graph, yet we know, when done properly, the savings that you get because you weed out poor care. Poor experience relates to expensive care, that's known. So not to track the experience is essentially to say we'll accept waste, or we won't use a simple, cheap tool to detect waste. So I think those sort of the cost and the focusing on the next generation are two massive areas.
Maybe I can use the position of chair and ask you a follow-up question to that, because in terms of asking young people, we have asked patient groups at European level about benchmarking health systems, and I'm thinking of a very helpful workshop run under the Czech presidency of the European Union a few years ago in particular. And we had some very clear feedback there of patient groups saying, well, I can tell you whether the appointment was on time and whether or not the food was good and whether or not the doctor listened to me